Thank you very much, Benedict. And thank you, Suli, for the kind introduction and also allowing me to speak on this platform. I'm a public health professor, so most of my work is on policies, but also on public health issues. However, we were engaged with so-called vaping, which was commissioned by the Ministry of Higher Education at one point in time to look at vape in our adolescents from public and also private universities. So what we found out at that point in time was that vaping is not good. You should not be vaping, especially in schools. And the policy to deter students from vaping came out from the public and also private universities. That was, I think, about 7 years ago. But the more I found out about vaping, which was the research in place, is that it is used by some of the countries like UK and Sweden and so forth. It is used to stop smoking as one of the tobacco alternative. So this sort of brought my interest on vaping, and especially in Malaysia, where vape is a predominant alternative for nicotine compared with, let's say, snus and so on. So I'm also the current president for the Malaysian Society for Harm Reduction. We do try our best to look at as much as possible on vaping as a harm reduction alternative as well. So I think a lot of the introduction has been mentioned by Benedict, and I don't think that I'm not going to go into detail on this, but most of the Asian countries, we receive the brunt of the problem. We receive a lot of tobacco influx for the country, coming in from big tobacco, but also from local players as well. Example, Indonesia is a producer of tobacco, and China is also a producer of tobacco, and most of this tobacco comes into Malaysia. At what point in time, the prevalence of males more than 15 years old who are smokers is about 40%. That's how high is the problem. And the other issue is that we are, again, abundant of black market cigarettes as well. So comparatively with other countries, especially with Singapore in Asian countries, we are consider a high prevalence of smokers. Indonesia and some of the other countries just might lead us a bit, and we all know about the harm reduction. Harm reduction is something which is not new in Malaysia. Everybody knows about harm reduction, especially for the healthcare. But on tobacco harm reduction, this is a sensitive issue. It is not well taken up by the medical fraternity. I think a lot of countries also face similar problems. We do know about harm reduction, but when we talk about tobacco, especially in Malaysia, we have a very good terms with WHO. So in a way, we follow WHO standards, where they will say anything related with nicotine as well as something is related with tobacco. It's considered as a smoking. So this is not well received by the medical fraternity. A few of the so-called medical fraternity, things like the psychiatrists, addiction specialists, they know the problem, and especially GPs as well, because you see cases coming in, people who smoke who are not able to quit using the traditional method. But the rest of the population, we are seen as something which is talking really weird, about tobacco harm reduction and so forth. So it is not well recognized. And as mentioned by our good friends and speakers, Dr. Anderson and also Dr. Frederick, nicotine is not the problem. It's the tobacco itself, the burning and also the tar coming from tobacco. But a lot of this misinformation is not being communicated. A lot of disinformation are being replicated. And I'll just show you a bit what's happening in Malaysia as well. So we have the problems of youth vapers now, and vape is popular in Malaysia, comparative with snus. So vape is being stigmatized as a gateway effect into not only smoking but also into drugs. So this has been again mentioned again and again about the issues of vaping in Malaysia. So we have the problems of now youth are taking up vape, as been mentioned by the statistics. So a lot of us have sort of reduced tobacco but increasingly using vape. A lot of these are experimental, yes. Not all of them are using this daily, but they are current users. And the problem is that this has been stigmatized as something which is not only detrimental but causing addiction among the youth. And that's happening in many of the Asian countries, including Malaysia. The tobacco control has sort of been agreed even by local, this is a local newspaper cutting saying that, even though the tobacco control, which has been done in the Empower and things like that in Malaysia is there, is available. However, the regulation is not, that strong. Enforcement is not that strong, even though, I'm sure the government is trying our best. But the experts agree that the tobacco control has not been really that strong, and this has been come out in some of the public domains as well. High burden of illicit cigarettes. This is some of the reports. It's increasing day by day. It doesn't really comes down. That's the problem. And most of the governance would actually increase your tax. We have such a huge amount of tax increment, excise hikes of about in 2 years to 2013, 14 and 15. It does not actually reduce the smoking rates of legal tobacco. But what happens is that people transition into illegal tobacco. And illicit tobacco, or so-called black market, is so widely available. I mean, me with the hijabi, we were going around the streets and we were like, oh, can I buy like a tobacco? And they'll ask me, okay, you want the power one or the less power one? And I said, like, yeah, I want the powered one, the red one. So even, for me, I can purchase illicit cigarettes. What more about the youth? And they have downliners and things like it's like selling Tupperwares. They can go into the rural area and just buy these, single cigarettes and all. And this is happening. Not. It's only not. It's not in the urban area. You have it in the rural areas as well. So this is a problem. And I think this is largely ignored by certain members of the government. I'm not sure for what reason. Of course, there's stories behind there. But illicit cigarette is burgeoning, and most of the states who are in open waters, what we call as near the open waters. So these are some of the states which are really exposed to illicit cigarettes. They can just bring in with tankers and by ships and all, and they will get down and be distributed widely. Yeah. So this is scary. So I think I'm not going to talk about this so much. Benedict has mentioned that, and I'm just going to show that we have the transition where most of adolescents do not actually continue smoking, but they'll go into vaping. So what happens is that some of them will be using dual uses, tobacco plus vape, but some of them will be using poly as well. And this is something that a lot of us has been not only worrying, but some of the research do shows that once you are going into dual using, the number of cigarettes that you smoke are actually reducing. So they start to use vape, but also cigarettes, but the number of cigarettes that they use per day is actually reducing. And this for me is good. Even though you're still considered a dual user, you are actually reducing your risk by reducing the number of cigarettes. This has been published. And some of my PhD students are doing, PhD students, they publish the whole thick thing. And sometimes when they finish, they only publish one paper and then they run back to the Ministry of Health and the whole thesis is there, nobody to publish. But it's already something which is documented. So the vape has increased, 0.8 in 2011 to about 5.8 in 2023, and most of these are the young population. So the profile, this is a study done by the vape industry themselves. The vape industry here is relatively quite strong. These are small distributors of vape. And very interestingly, they are exporting to UK and other developed countries. Their products actually make it into the developed countries, example UK. And they were, of course, as a researcher, we talked to a lot of people, not only respondents and patients, but also local populations, but we also talk to industries because we want to know what's the problems or what are they, how big is the issues and what are they doing and how is the regulation for vaping and things like that. And they were telling us that when they export, the stringent quality control there is very high, meaning that whatever that we are selling on the streets in Malaysia is probably even lower quality. And that's the problem. That's the problem. When they go into UK, there's even a surcharge if there's any like microorganisms or bacteria, or if there's any toxicology report that has not been done and things like that. So that's how strict is that in the countries. And we don't have it in Malaysia yet. And this is why we are trying to push the government. We keep talking to the media. We keep talking to the newspapers. Is that we need a regulation, but we need a regulation that also mention about the quality control of the vape products. In a way, they have to be either registered or being monitored by some entity, by the government itself, to make sure that the toxicology reports, some of the products are free of drugs and things like that. So, and people keep saying about the diacetyl, it comes out again and again and again. But if you look at the actual, some of the data shows that, cigarettes has more diacetyl than your vape. it has 10 times more diacetyl in your vape. And we keep saying that, oh, the vape will have diacetyl, the vape will have diacetyl, but your cigarettes have more diacetyl than your vape. So in many of the countries, example UK, MHRA will have the quality control actually exclude, you cannot have diacetyl in fact in your e-juice. So that's not happening here at the moment. And this is why we are worried. So when we tell people to switch to something safer, then they ask us, advocates, okay, which vape shall I use? And I will say like, okay, that's the problem. Because at the moment, there's no quality control. There's no quality check. So which one shall I advise? And this has to be properly managed. So I'll share the slide later on some of the products. So they mentioned that most vapes would actually use vape almost daily, 60%. Young people, mostly the Malays, the predominant ethnics in Malaysia, most would actually use both as well, nicotine plus the non-nicotine. Fruity flavors are their main forte here, and some would actually use that as a means to quit smoking as well. This is the majority. Most of my respondents in my study says that they want to quit smoking. And this is a very good initiative. They do want to quit smoking, and we need to help them. That's the problem. Some of the already registrations or guidelines available, things like the device, certification for e-cigarettes by our so-called SIRIM is already available. This is the first edition in 2022. There's going to be more. Of course, you have to pay some of the payment for companies to actually register their products and things like that. And there's many studies. I'm not going to elaborate on each one. I'm just trying to show to you these sorts of studies are widely available. It's just a matter of you trusting the research and the science behind it. And whatever, some of the local studies, when we present to, example, policymakers, and they say that, oh, this is sponsored by tobacco industry or vape industry, and we tell them this is not sponsored. We get no incentive from these companies, and they say that no, I don't believe you and things like that. So this is something which is really peculiar. How are we going to progress if you don't believe the science? And if this is overseas results, then they say, okay, we need local studies. And when we do the local studies, they say, okay, you must be sponsored. And then in the end, basically there's no study. Just trying to show how big is the data available. This is some, I'm just showing you one, which is published in 2024. You can have a look at it for those interested. Looking at some of the studies, there's even Cochrane reports. This is a study compiling on 33 studies, and so on and so on. How effective are the alternative nicotine products in reducing some of the NCDs and things like that? So in this statement, the conclusion says that smokers or former smokers who switch to vaping products may reduce their exposure to carcinogens, lower the risk of developing severe health issues associated with conventional smoking, and so forth and so forth. And that's an excerpt. If in healthy individuals who have never smoked, this is not something which is encouraged, right? But for people who are already smokers, non-smokers who are not able to quit, these are something which is really useful for your health. So another study which is local, I did not show my studies because if I show my studies, then you say that I'm trying to self-propagate my results. So I'm showing someone else local studies as well. It never really came out. It never really took off, because it has been like trying to hide the truth. And we are trying to promote the truth. And this initiative may actually benefit some of the local populations, but it doesn't really works well with a lot of the policymakers. So these are some of the local studies. Comparing dual users and e-cigarette users, and of course CC, the conventional cigarettes, traditional cigarettes, whether how much are the rates of quitting and things like that. And they conclude as well that the rate of quitting conventional cigarettes were higher among the sole e-cigarettes users compared with dual users. And this was reported, for 6 months. There's no serious health effects, and so on and so on. So there's multiple studies like this. So what I intend for all of you is that go and do your own research. If you don't believe us for some reason or the others, look at the external experts. You look at other countries. You look at other reports. There's multiple already there. Don't just, if it's only me, then people will say that, oh, you must be sponsored because you keep saying this again and again in multiple settings. But we're trying to convey to people there's going to be a benefit for a group of population, especially for the lower income and disadvantaged population. There's already a Cochrane review. What more do you want from that? There's already a huge Cochrane review which already reported some of the benefits of you quitting. And I think the expert has already mentioned, Sweden works well with snus. Some other countries will use heated not burn products like Japan. In Malaysia, vape is very much in the market. Unfortunately, the control of the quality of the vape products, this is something that we need to work on. Malaysia has started with the Generation End game. At one point in time, we wanted to emulate New Zealand, but as mentioned by Suli as well, it's difficult replicating without knowing the issues and what happens afterwards. So this was some of the initiative by the government, how they want to reduce the smokers, coming up with the Generation End game. This was obliterated at one point in time. So the State Assembly in Malaysia, they passed the Control of Smoking Products for Public Health Bill in 2023 that prohibits the selling of the vapes to minors, less than 18 years old, including substances such as propylene glycol and so on and so on. And we should not be using it to promote, to discuss, to glorify the use of alternative nicotine products. So in a way, but they also removed the GEG. So interestingly as well, New Zealand actually stopped the initiative. They abolished, with the new government, they announced the abolishment of the smoking laws, the GEG and all. Many reasons. Some of them would say that there's an opportunity for the black market to emerge as such in Malaysia. Concentrating the cigarettes in one store actually have a massive magnet for crime, and they want to use the money from the e-cigarettes and vape as to build up the nation. This is a post-COVID strategies. So New Zealand actually scraps the first world smoking generation end game at that point in time. This was, I think, last year. It was announced that they scrapped the GEG. So what is the current trend of vape, so-called, I would say this as misuse as well, because this is not the intended use of vaping in the first place. They are so innovative, not only that we don't have the proper labeling, meaning that they say no nicotine, but there's nicotine. They say 3%, but it's actually maybe 11%, something like that. No proper labeling. Some would actually experiment with drugs. Drugs in Malaysia, as we mentioned yesterday, is a capital punishment. You should not be doing it with drugs. There's a lot of countries which actually has the same strategy as Malaysia. Philippines is one of them. The vape ban actually deter people from mixing drugs in their vape. But in Malaysia, we are so innovative. We have all these new psychoactive substances. The chemical department, I think, has a problem, delineating the drugs in the vape products. They use this with multivitamins, they use this with caffeine, and now they even have it in the vending machines. So this was it was a huge hoo-ha at one point in time, because the vending machine is an access for use as well. So we can always buy this online. In some of these examples, I tried to buy this online. And this is THC. So this is cannabis oil, and you can actually buy this online. So the cannabis oil is one of the thing that happened in E-Valley. So it was because of the THC was mixed with vitamin E, acetate, and so on. So they are able to purchase this online. And they even mentioned that the quality, as the stringent so-called custom is being abolished. You can just buy it and they'll send it at home. So this is online purchase. Now what happens is that some of the GPs are promoting vape as a medically assisted framework. Yep, and we are working with some of the GPs together with some of our colleagues here as well, using vape, which is, we have tobacco control, already done the toxicology report and things like that, but this is Australia's method, prescription method. So they have come up, Malaysia is going to come up with their own regulation. I think it's going to come up in October. And we don't really know what's going to be in it. It's going to be, are they going to say no to single use? Are they going to say no to multiple flavors as many other countries? Are they going to have quality checks as in the TPD or the TGA in Australia and so on? And in the end, what the government wants is that it's going to be nicotine abstinence, not only cessation. Yeah, so this is the coming act, Akta 852. So potential life that can be saved, one of the latest report by Yach et al. That shows, if we are able to not only use THR, but also better lung cancer strategies and so on, this will have the maximum impact for low middle income countries, including Malaysia. Right, okay, thank you very much.